For my first literature review, I absolutely had to review the PAL trial. So PAL, Physical Activity and Lymphedema. Now this isn't a new trial, it was published in 2009, but it was really the trial that changed everything in the way current clinicians practice, and it was published right as I became certified as a lymphedema therapist. I had been practicing as a physical therapist for about 8 years at the time, but I knew nothing about breast cancer rehab training. So when I started seeing my first slew of patients, they came telling me that their surgeons had told me they were never able to lift more than 5 pounds again, that they shouldn't be exercising, that lymphedema was a really big risk and they weren't supposed to do any strength training. So that's kind of the influx of first patients that I received. And Dr. Catherine Schmitz and her team were hypothesizing that there was no real substantial evidence to back this up. So she did the first trial looking at breast cancer patients and women who either had known lymphedema or who were at risk of lymphedema to see what effect strength training had on their affected limb. So this was the first large randomized controlled trial. There were 295 participants, 141 who had known lymphedema, and 154 who were at risk of lymphedema. At risk for the purposes of this trial meant 2 or more lymph nodes were removed. So to sum it up, this trial was 1 year in length. For the first 12 weeks of the trial, or 3 months, participants were randomized into an exercise group or a control group. The exercise group would exercise twice a week for 60 to 90 minutes with a certified trainer, and each session consisted of an endurance or aerobic warm-up, strength training of large muscle groups, including the muscles of the arm, a stretching component, a walking component, and they were monitored weekly. And then for the remaining 9 months of the trial, the participants would perform this independently at home. So a flare-up of lymphedema was considered any patient who had a complaint of a change in their symptoms or a feeling of swelling, or a change in arm measurements of 5%. So if the arm increased 5% from 1 week to the next or over the course of the 12-month trial, or if the difference between the affected limb and unaffected limb reached a 5% difference. So there's a lot more detail about how the trial was performed and things like that in the information, which I'll attach below. But I think what's more important is that we look at the results. So the first arm of the trial looked at the women who were at risk of lymphedema. So they had at least 2 lymph nodes removed, like I said, and they had no signs or symptoms of breast cancer-related lymphedema at the onset of the trial. And the conclusion was that a program of slow, progressive weightlifting compared with no exercise did not result in an increased incidence of lymphedema. So strength training did actually not increase the risk of lymphedema in these patients, and instead they got stronger and saw the benefits of a regular exercise routine. So now, if we look at the second arm of the trial, looking at weightlifting in women who had a known breast cancer-related lymphedema, we were able to find that slow, progressive weightlifting had no significant effect on limb swelling. It actually resulted in a decreased incidence of exacerbations of lymphedema. It reduced their symptoms of lymphedema, and it increased their strength. So if the patient already had lymphedema, they were actually seeing benefits from strength training. So right as I was becoming comfortable with treating these patients for their lymphedema, I started at that time to implement first basic weight training and then teach these patients that a slow, progressive exercise program would actually be much more beneficial in the long run and would not exacerbate their symptoms. There are always exceptions to the rule. There are always going to still be patients who are afraid or whose doctors tell them they don't want them to exercise, and for whatever those particular reasons, we must obviously acknowledge the doctor's wishes and follow those restrictions. But for patients who are just saying this out of fear, if we can show them the research that it's beneficial, that there are so many other benefits to exercise aside from just reducing exacerbations of lymphedema and in fact not increasing their risk, they're much better off learning from a trained professional on how to exercise slowly and safely. I usually recommend patients wear a sleeve. Patients did wear a sleeve if they had known lymphedema. They did not if they were only at risk in this study. So it's important that we keep all of these things in mind when prescribing exercise routines for our patients. I hope this has been helpful. Please let me know if you have any questions, and also let me know what else you'd like to know about. Thanks, everybody. Have a great day.